Hey there, in this video we are diving into the rectus femoris muscle and its connection to massage therapy. This muscle, part of the quadriceps groups, originates from the hip's anterior inferior iliac spine and attaches to the patella and tibial tuberosity. Join me as we explore how specific massage techniques can ease tension and boost flexibility in this important muscle. Let's dive right in. So, the rectus femoris muscle is a major player in your leg movement. It's super important because it both straightens your knee and bends your hip. When you're walking, going upstairs, or doing exercises like squats, this muscle is hard at work. When you're given a massage, understanding how to ease tension here can really help your clients move better and feel more comfortable. Now that you have a good understanding of this rectus femoris, let's get into the body work. Start with your patient face down. Bend one leg at the knee, bringing the heel towards the glutes. Gently grasp the ankle of the bent knee and slowly pull it towards the glutes, maintaining a gentle, controlled pressure. Ensure your client to communicate any discomfort whatsoever and stop if they feel pain. Side note, for an added tibialis anterior stretch, use this alternative grip, ensuring your patient has sufficient plantar flexion ability. Hold the stretch for about 5 to 15 seconds, allowing the sensation of the stretch to ease into the muscle, then slowly release the leg back into the starting position and repeat on the other side if desired. Raise one knee using a bolster or rolled up towel to deepen the stretch, extending the hip and positioning the knee behind the hip. Move slowly as this significantly amplifies the stretch. Initiate the massage session by applying general strokes of your preference to the warming area. I like to opt for broad and firm movements, repeating them consistently to ensure effective and thorough warming. It's essential to moderate the use of lubricant, aiming for just enough to allow slight drag on the skin. This resistance helps establish better traction and connection. As an additional method for warming, consider incorporating cupping into your practice. Apply a small amount of lubricant around the rim of the cup and introduce half to 1 pump of suction. This technique is known as running or gliding cups, where the cups are moved along the skin. Always prioritize the patient's comfort. Check in with them regularly during the process. It's important to note that this technique may lead to some superficial skin bruising. You know the area is properly warmed when you feel radiant heat as you hover your hand over it. This indicates that the tissues are ready for additional, deeper techniques. We're now advancing to deep stripping. Starting from just above the patella insertion point, aim for at least half an inch of depth to elicit a tissue response. Maintain a slow, steady tempo throughout. If you require more depth, place your hand or palm directly over the wrist and thumb to apply additional pressure. Remember, always prioritize your patient's comfort. Check in regularly. Observing their facial expressions or hand movements will often signal their response to the pressure applied. If your hands require a break or require more pressure, consider transitioning to the elbow technique. Remember, the contact point should be about 1 to 2 inches below the pointed part of the elbow. Maintain a slow, steady pace throughout the technique. In my experience, the quadriceps often prove to be a sensitive area for most patients. To apply additional pressure, clasp your hands together for a hand hug. Always prioritize proper lunging and body mechanics for optimal execution. Transitioning to one of my favorite aspects of the massage, as it involves the active participation from the patient. This technique employs more active strokes. Guide your patient to flex their hip to full flexion and instruct them to slide their heel at a 3 to 5 second tempo until the leg is fully extended while you apply pressure. Release the pressure as your patient returns to the starting position. Consider demonstrating this movement with light pressure to ensure clear understanding. Focus on the origin of the rectus femoris and repeat the sequence as needed. For the next active strokes, position your patient's leg off the side of the table. Use both thumbs to apply localized pressure, starting from the insertion and progressing inch by inch towards the origin, moving from distal to proximal as you guide your patient to extend the knee. Once you reach the origin, reverse the strokes by starting with a straight leg and moving from proximal to distal as your patient flexes their knee. Release pressure as your patient returns to the starting position. If your patient desires a deeper stretch and has the ability, they can reach down and flex their knee by grabbing the ankle. Always be mindful of the hand nearest the inner thigh. Maintain a distance from the patient's discomfort zone. The mid-thigh area is the limit. Beyond that, curl your fingers to ensure proper boundaries. For our final technique, we'll perform a passive stroke where the patient remains relaxed. Begin with the knee extended, keeping a steady pace. Apply direct pressure at the insertion and fully flex the knee, gradually moving towards the origin. This approach is similar to the previous techniques we covered, so I'm not going to go into it into detail. As we conclude our exploration into the wonders of the rectus femoris, I hope you've gained some valuable insights into the world of massage. If you found any value in this journey, consider subscribing and tapping the like button. It truly helps. Remember, this is just one muscle in a multitude awaiting to be explored. There's plenty more to uncover, and stay tuned. Massage isn't a one-size-fits-all practice. It's about sharing my unique style and insights one muscle at a time. Sending heaps of good vibes your way. Until next time, take care and keep exploring. Peace.